like to welcome everyone to our combined in-person and Zoom career development conferences, and in collaboration with Alliance of North American Chinese Physicians, who will, bring us IT support on the Zoom and bring us more online audience as well. So each year, ACAP support, have two major conferences to support our foreign medical graduates, especially Chinese medical graduates. So each September, we do have mock interview, and which we hold right here in Flushing and at Sheraton Hotel. This year, we already have a date, September 24th. You can mark it down if that interests you. So we provide one-on-one in-person mock interview experience and prepare our medical graduates to have a successful interview season. And every March, like now, so we usually choose the Sunday after the match week, and we get together, congratulate our the medical graduates who successfully matched to their desired residency program, and provide support, go through their residency or fellowship or early career in medicine, or we support our newcomers who are preparing to go through this process and to become a physician in America. So this year we have outstanding speakers, was including two program directors, Flushing Hospital Internal Medicine Program Director, Dr. Beekman, and Westchester Medical Center Surgery Program Director, Dr. Kong. And we have other attendings and the fellows and the residents who will share their experiences. And hopefully our audience will have a great, the outcome from today's conference. So I would like to thank all the speakers giving up this beautiful Sunday, come to supporting us. And for the audience, if you feel this is a valuable experience for you, I urge you to join ACAP and become part of the program. You can come in next year, to share your experience. And I also like to thank all the sponsors. Without your support, we're not going to have a successful event. Now I'd like to acknowledge the co-chair of this conference, Dr. Ziqiang Zhu, and Dr. Han Bao, who put up this outstanding program. Without further ado, let's get Dr. Zhu to start the program. Thank you.
Good morning, everybody. It's so nice to see everybody here in person. And for the past 2 years, we have been doing Zoom for this conference. And this year, we finally decided to invite people to in person and as well as Zoom live stream. So without further delay, I'm going to introduce our first speaker, Dr. Karen Beekman. Dr. Beekman is a program director of internal medicine in Flushing Hospital. She has been the PD since 2005, and she is also an associate chair of Department of Medicine. And Dr. Beekman graduated from Columbia University College of Physicians and Surgeons. She finished her residency at New York Presbyterian Hospital, and she's a program director. And let's welcome Dr. Beekman. Thank you.
Morning, everybody. Fix what? Oh, the clicker. Okay, got it. All right, they like the clicker. Good morning, everybody. The residency application process at times is confusing, at times overwhelming. It certainly is very, very difficult to decide which programs you're applying to. There's a lot of information out there. Sometimes that's overwhelming as well, but we'll try to make some sense of that. There's that. It's not clicking. Okay. There we go. All right. We can divide this into really 3 parts. The second is the interview process. And the third is the NRMP match. There we go. Okay. What is your timeline for the application process? It's now March, right? So we need to start thinking, you need to start getting pieces together. Actually, my residents will be applying for fellowship shortly. Usually late March, early April, we start meeting to talk about this process for them because they're on a pretty similar timeline, although their interviews are earlier. In early June, ARS will open for you to start putting documents in. What do you need as part of your ARS application? You're going to need letters of recommendation. We'll talk about those later, but just know that you need letters of recommendation, you need a personal statement, and you need a CV. So you need to start thinking about all of those pieces. In late September, the residency programs will begin reviewing your application. We do not get access to your application until late September. And your MSPE will also be downloaded at the same time. Generally starting in early October, going through early February are interviews. I just was having a chat about whether interviews would be in person or virtual. I have a feeling most programs will be in a hybrid mode, perhaps some in person, perhaps virtually. And that really is an economic decision, I think, on the applicant's part. They really are legislating for interviews to remain virtually, as this conference is now sort of a hybrid conference. We have many people there on Zoom, and many of you chose Zoom because it would have involved travel to come to New York City, hotel, and other expenses as well. Early March, your rank order list is due, as is the rank order list for the program. And then in mid-March, and today, and this year it was March 17th, is match day. Okay. Your ARS application includes a CV that has your demographics, where you went to medical school, your date of birth, your visa status, your experiences, your research, your volunteer activities. So start thinking about them. I know that I easily forget things that I've done during the year. Once a year, I have to come up with a board report as to what has happened. And then I go, oh yes, I did this. And so it's good to be able to keep it current, keep your documentation good. You need 3 to 4 letters of recommendation. What do we want in a letter of recommendation? We want to know that somebody knows you. An applicant came up to me earlier this morning and asked about the different experiences that you could have. I think the most valuable experience is not necessarily one for a week or two in an observership or externship, but actually something where you are continuing to work with an individual, they get to know you, even if it is in a slightly more different position than you would be caring for patients. Perhaps it's as a medical assistant answering the phones, but you are interacting with patients. I think that those can be really valuable experiences for you. A lot of the observerships and externships have very much a template that they use to evaluate you. After seeing many, many applications, it's sad to see that so many of the letters look so similar. That's why I'm saying go find yourself a place where you can distinguish yourself. You need a personal statement. What is a personal statement? This may be very different than anything you've ever done in your life. Personal statement is who you are as a person, why you want to be in medicine, why you want to be in that subspecialty, and a little bit about you. I like to read those personal statements because I want to get to know my applicant, who you are, where you came from, what your journey has been, what challenges perhaps you've had to overcome to get to where you are today. So think about that as you're writing your personal statement. It really does help us to get an idea of who you are. If there's something unusual about your application, or there is a pending visa change for you, you may want to address it in a portion of your personal statement. Personal statements can be updated over the course of the interview season. You can upload a new one. All right. Your medical school transcript, that's pretty straightforward. Hopefully your medical school will submit it in a timely fashion. Same thing for your medical school performance evaluation. Start working on getting those documents if you can. ECFMG certification is different than it has been in the past. It no longer involves the CS exam. It does involve the occupational English exam. So you will, and it involves selecting a pathway and submitting documentation to ECFMG. So that's another thing to become familiar with. And your licensing examination transcript is probably the easiest piece to get. All right. Your application should be neat with appropriate capitalization, grammar, and spelling. Very often, international graduates are not familiar with some of the conventions in terms of capitalization of street names, of schools, of people. Just have somebody take a look at it. Make sure your dates are accurate. Too often, even in people that I have interviewed, some of the interview questions are, this date does not look exactly right, and usually I'm right that it's wrong. That's not a good thing. Make sure that you know the dates of your medical school attendance, the dates that you worked in various places, your degree dates. It should all flow through and make sense to somebody reading it. Okay, we talked about the personal statement. And again, have several people proofread and also critique what you're putting on your application. You are asked to put narratives for the various experiences that you have. Please keep them brief and tell us what happened, not like 5 pages. Okay, you should obtain experience working in the United States healthcare system prior to your application, either as a medical assistant, volunteer, or observership. Those are all possibilities. Be careful of some of those opportunities. I would rather see you working one-on-one with a physician in an office as a medical assistant. Certain observerships tend to be very large groups of observers. I know that has been harder to secure, post-COVID, during COVID and post-COVID. Just be creative in getting your experiences. Your letters of recommendation may include international experiences, but should also be from experiences in the United States. It can be a mixture, just don't have only international letters of reference. Okay, how do you pick those programs to apply to? There is a database called FRIDA, which is the AMA Residency and Fellowship Database. It is very, very comprehensive. It includes information about visa sponsorship, IMG percentage, and deadlines for applications. Many programs have expanded listings, including minimum requirements. Use this resource. If you require a visa, don't apply to a program that does not sponsor visas. My program does not sponsor visas, and every year I get applications from people who clearly state they need visa sponsorship. It's a waste of your money. I don't care about my time in looking at that because it is one of the first fields I will look at on an application just to make sure. But, you know, just target yourself to the programs that will consider you if you're in that category. If you are in an adjustment of status category, that is one of the most confusing for everybody. I do understand that you have timelines that to you make a lot of sense, that you will clear your, you know, the various, you know, hurdles of going through that process, and they'll tell you, oh, you're going to have this definitely by March. Well, March is also match day. March, we've already had to put in our rank order list. If you don't have this, if you don't have the status at the time of the interview, I say I can't really consider you until you have changed your status. There are unavoidable delays along the process, so just remember that. The ACGME website also lists all accredited programs with contact information if you do have questions. They do not ask there about visa sponsorship or minimum requirements. Some programs do have very strict minimum requirements. Also, most programs nowadays have a program website. If you are very interested in a program, look at the program website. They do vary in how recently they've been updated, but what I'm finding is more and more programs are paying attention to their website because of the virtual world that we live in now. There may even be a video on that site. Look at it. Okay, again, you want to look at requirements, the curriculum. Geography is very, very important for many of you, especially if you have a significant other who has a job. Again, in the virtual world, a lot of people are much more mobile than they used to be, but geography still does play a role. You may want to look at current residents. How well do you think you'd fit in the program? Look at the fellowship placements. Is that what you want to do? Where do they go? What fields do they go in? Look at the board certification outcomes. That is available at the ABIM for Internal Medicine website, and it's published for, you know, 3-year rolling average is what they do. I'm not familiar with the other specialties, but I'm pretty sure that most of this is public knowledge. What is the accreditation status? If you're interested in looking at the accreditation history of a program, whether they've been on probation, whether they are on warning or something like that, you can go to the ACGME website and look at that. Okay. Again, I talked already about visa status. Confirm and again, I talk about the adjustment of status because that becomes such a conversation for us. All right. Letters of recommendation. Again, those template LORs are not that helpful. I've learned to know which places are going to give me a template, and the variability in that is not so great. It's helpful if it is from the specialty you are applying to, but more important to comment on your abilities and your work habits. Are you diligent? Have you gone out of your way to help patients in the past? And again, the need to have some from experiences in the United States. Okay. Since the cancellation of that USMLE Step 2 clinical skills during the pandemic, international graduates must apply via one of the 6 ECFMG pathways. You need to take the OET, the Occupational English Test, is only one of the requirements. I would say try to get that as early as you can. I know now it's a lot easier to schedule than it was at the beginning. Many people missed that first season in 2020, 2021 because they could not schedule an OET. You must take the OET according to ECFMG prior to the end of December of your application year. So if you're applying this year, the sooner you take it, the better, but you have until December 31st. More programs are requiring ECFMG certification prior to an interview invitation than previously. The pathways became very confusing to everybody. It's not for us to decide whether you satisfy the pathway, but to ECFMG. So a lot more programs are looking for you to be ECFMG certified. We do not see your score on the OET. So this is very different than it was previously. If I had an applicant who was a medical school graduate and had passed CS, we were relatively certain they would get ECFMG certification. Now, because we cannot see the OET results, we don't know. If you don't pass OET, you won't get ECFMG certified. If your certification is pending, you may want to describe the pathway you selected and how you satisfy it and what your OET status is, because as I said, we don't know what it is. So if you passed it already, tell us. All right, what do we look at when we look at an application? We look for probably number one, some experience in the US healthcare system. Your scores on the USMLE examinations, including the number of attempts. Many of the institutions have dashboards where they ask programs to report how many of your residents were first-time test takers that passed. There is a correlation between that and board passing, and that's where the institutions come looking for that on the dashboard. Whether or not you're ECFMG certified and what your current visa status is. What your medical school is, we do become familiar with a variety of different medical schools, things that I never thought I would know about before, I do know now. As to rankings of some of the medical schools in the various countries, as well as your year of medical school graduation. Whether you've had previous international residency training, whether or not you've been involved in research, your personal statement, your letters of recommendation, and we do look for ties to the geographic area. I know ARAS right now permits you to do a supplemental application, which asks you about geography and why you want certain geographic areas. That is definitely a worthwhile thing to do. And to include, why you have a particular affinity for one area or another. Okay, when do you apply? Best to apply early. Many programs will go through that first group of applicants and sort of fill most of their interview positions. My program gets about 3,300 to 3,500 applications each year for a total of 25 spots. That's a lot of applications. At least half of those applicants meet our minimum requirements in terms of scores, attempts, experiences. How do I pick? Right? We're only down to maybe 1,500 now. I can't interview 1,500 people, imagine, and do a good job of that. So we need to look for other things in terms of that application. And that's where you can distinguish yourself. Other programs just cut it off and say, all right, I've had enough is enough. And they do not invite after October 15th, November 1st, whatever date they use. So it's something to think about. Make sure your application is ready to go on the release date. You have from June through September to get it ready. Again, I put in here with the ECFMG certification, that's really important. But if your visa status is about to change or your ECFMG certification is pending in a week or so, it may be better to wait until the application is received, as long as it's no later than mid-October. Alternatively, you may clarify that situation on your application and state that by mid-October, I will have this visa status, or I will achieve ECFMG certification. Okay. The 2021, 2022, and 2023, the interview process was virtual for nearly all programs. I am aware of some programs this year that did have in-person interviews, but they weren't many. For 2024, we do not have recommendations yet. All right, so I'm talking about the 2023 to 2024 application year, which is really matched 2024. Likely be in person, but there are no final decisions yet. As I indicated before, the hybrid is probably likely. You can distinguish yourself by making arrangements to present yourself in person. That could help you. That could certainly be a deciding factor for some programs, is whether you have done that extra step to come see them. I'm absolutely amazed that we can match applicants who have never set foot into the hospital. It's really, you know, it's one thing to book a hotel room on Expedia or something and then walk in and, okay, this is what I have. But, you know, booking a residency program like that is a little scary. I think there is definitely that a benefit to the applicant to get to see the people in the program, meet them, see the hospital, see the interactions between residents and staff, between residents and faculty. It's just little things that you can see, and that has been missing over the past few seasons. Okay, what happens on interview day? We kind of morphed it virtually the same way. We did an overview of the program. We did do a tour of the hospital, but it was a virtual tour and available on our website. We do individual and also some small group interviews, and we gave you a chance to meet current residents. A little more abbreviated because it's all online, but that really is what tends to happen on interview day. New York City programs tend not to have those dinners the night before. You go out of New York City, you may well be invited to dinner the night before, dinner afterwards with the residents, a social hour with the residents, something like that. That doesn't tend to happen in New York City for some reason. Okay, tips for your interview day. Come early, but not too early. I'm generally in the hospital between 6:30 and 7. Our interview day, when we had in-person interviews, began at 12:15. And occasionally I would spot an applicant in the lobby before 7. And, you know, you kind of stick out when you're wearing that suit and nobody else is wearing a suit sitting in the lobby. So it was really easy to spot you. Either you were an applicant or you were here from a regulatory agency. And it wasn't that hard to tell the difference. So kind of interesting. You know, and what are you going to do? We had people who came up to the department and said, I'm here. And I'm like, that my coordinator go, that's nice. You could go across the street to Dunkin' Donuts. We really don't have a lot of places for you to kill time in our neighborhood. So, all right, you could go for a nice walk, but it's generally wintertime and freezing cold outside. So time it appropriately. Make sure to research your programs online before you come. Double check the directions for in-person interviews. Many people may know that there are 2 hospitals in Flushing. Can't tell you how many times we have heard from people either from the backseat of a taxi or something like that, saying, and people even by taxi cab drivers have been left at the wrong facility, and we have to tell them, Jake, you've got about a mile walk. So just double check where you're going, the address, so you know it, okay? Check your technical equipment for virtual interviews. Make sure the lighting is good. Make sure your camera is good. Your microphone works. Your dress appropriately, no matter what. We expect you to be in business attire, even if I tell you that makes you look really funny sitting in our lobby. It's okay. We expect you to be adult and professional. Make eye contact when you're speaking with somebody. For certain cultures, that is a no-no, but in US culture, if you don't make eye contact, you're looking a little shifty to somebody, and that requires practice for certain people. Behave professionally. We are watching you, no matter what you're doing, even if you are sitting on a Zoom chat with your fellow applicants. It always was very, very interesting to sort of go to our chat room while people were our waiting room and listen. Sometimes the conversation would be absolutely wonderful, and they'd be talking about their favorite foods and their favorite restaurants. And usually for us, we had some local authority on Flushing who was interviewing that day, who was providing local information to the other applicants, which was great. That's normally what happened in our waiting room, and we never really knew it. But we got to see what was happening. Just make sure you're not making comments about programs in that waiting room, because people can overhear you. All right. Practice interviews with your colleagues to improve your communication skills. I can't emphasize that enough. Relax and enjoy the interview process. It really is a conversation between you and the program, whether it's on Zoom or whether it's in person. Also, please select a neutral background and avoid interruptions. We've had puppies, we've had cats, we've had parents, children. What else can I add? All appear in the background. So make sure that you kind of have a very neutral background. Avoid religious objects in your background. For some reason, that popped up a lot this year. People were trying to distinguish themselves from other candidates and were strategically putting things in the background. Neutral is better. Okay, we'll ask you general questions regarding your background, experiences, and interests. Some programs will ask general medical questions. Don't be too intimidated. They may ask you to recall a case and discuss. Behavioral questions, seeing how you react to various situations, are becoming much more utilized by programs. And some programs are actually asking you to take the ALTIS or CASPER testing, which is a form of behavioral questions. So just be aware, if the program asks you to take it, you will need to take it. It does involve an extra fee. Most programs will give you a chance at the end of the interview to ask questions of your interviewer. Come up with 1 or 2 questions so you don't feel like you have nothing to ask. All right. Post-interview etiquette, you could ask your interviewers for their business cards if you're in person, or ask the coordinator to. You can send brief thank you notes to interviewers and program personnel, but there are programs that strongly discourage post-interview communication. Just be aware of that. They usually will let you know that we do, that your presence today is our thank you. Please do not crowd our inbox with a lot of thank you notes. We do understand that you are trying to distinguish yourself, but remember, most of your interviewers are actively in practice as well as interviewing you. So, less is sometimes more. Your application should be strong enough to speak for itself. Okay. Your NRMP match requires a separate registration and fee. The algorithm definitely favors the candidate. It takes your choices before it takes my choices. Remember that. You will go to the highest program on your list that has space for you. Rank programs in the order of your preference. Don't try to game it. Oh, this one's going to take me, that one may not. Well, if the may not one is the one you really want, put it above the other one. It's okay. The supplemental offer and acceptance program is available for candidates who do not match. That's a whole separate program. There are different rules for that. If you get in that position, you'll learn what they are. All right. Does anybody have any questions? Anybody online with questions? Oh, yes, go ahead.
Thank you for that wonderful talk. My question is, do you feel that because there's such disparity in terms of programs reaching out with virtual versus in person, will the programs have certain inherent bias for one or the other? And I think that brings a lot of the equity issues. And how do we, as applicants, overcome that?
It's a wonderful question and one that we are all struggling with. I was not disappointed this year when we were all virtual, because I felt that exactly what you said, that there would be this disparity. COVID was still present. People were still getting sick. Everybody had a different level of tolerance, as well as perhaps a different level of health at various points in the year. We did have a number of interviewees who either postponed because they were sick or actually told us they had tested positive the day before or something. So there is, yeah, you're right. Economically, the difference between in-person and virtual is enormous. It is, huge. Traveling, especially for people in California who may need to go back and forth across the country. That's a considerable thing, but even within the Northeast area, driving, staying in a hotel, tolls, whatever, add up. Yes.
Follow up to that question. Is there a perceived bias towards the interest towards a program if you present yourself in person versus virtual?
I know we're going to be struggling with that more and more. One of the solutions for that, and it was an interesting one, is what ophthalmology did this year. Ophthalmology did their virtual interviews. The programs were told you must submit your rank order list by this date. And on that same date, you may invite your applicants to come for in-person open houses. The applicants have not yet submitted their rank order list, but the program's rank order list was closed. So being in person did not benefit the program, it benefited the applicant so that they could see and get a better thing. I think that may wind up being one of the strategies used in the future because it diminishes the importance of the in-person in terms of the program, but we lose so much when we don't get to see you in person. We really do. But I think we're learning to deal with it. For the applicant, they really may want, like, you order things online and you can return them, right? You order a residency program online, you can't return it. So I would say it's an interesting question. And one that, yeah, you're right, the inherent bias against people who have fewer resources. I know that at least for American applicants, there were loans taken out on the order of $10,000 to travel for interviews and maybe more. That's a lot. So, any other questions? Yes.
Thank you very much for your great presentation. May I ask year of graduation cutoff?
We prefer applicants that are within 5 years of graduation. For a variety of reasons, it usually means that you have not developed habits that we need to teach you as much. But I do realize that that is a challenge when we're talking about an international graduate as well. So, yes, 5 is kind of the soft cutoff. But as you get further and further away from medical school graduation, yes, it is a lot harder to go back and be a trainee again. It's not so easy. I mean, that's part of the problem. And the cohort of people that you're interacting, you need to interact with on a level basis as well. That year of graduation thing has been a sticky point for a lot. There are programs that are, can do a lot more with year of graduation. But I think when you're reaching 15 to 20 years post-graduation, it's hard to go back to accepting somebody constantly giving you advice. And we've seen that as well. Any other questions? Did you have anybody online?
Yeah.
If not,
Thank you, Dr. Beekman. Well, that's an excellent